Welcome to those that are coming into our webinar today. We'll give it just a minute while people get connected, and then we'll get started. Okay, so welcome to our webinar, How Are Students Managing? We have the pleasure of having some conversations with students today regarding how they're managing the pandemic, both from a student perspective as well as all three of our panelists are also employed, so how they're handling it within the clinical settings as well. So first and foremost, let me introduce myself. My name is Dana Tschannen, and I'm the Associate Dean for Undergrad Studies, as well as a fellow alum through the school for my bachelor's as well as my master's and doctoral degree. So blue through and true. So I'm so glad to have the opportunity to have this conversation with our students. And really the purpose is for you to get kind of a flavor of how some of their training has changed due to the pandemic, how they've experienced it within some of their clinical experiences as well as within their work experiences. You know, some of them have had externships this past summer that were modified a little bit, so they can talk a little bit about what that looked like for them as well. So to go ahead and get started, I'm first going to ask them to introduce themselves, tell you a little bit about who they are, their year in the program, as well as a little bit about some of their employment and their experience that they've had. So I'm going to start with the person on my left here, which is Jessica Viali.
Hi everyone, I'm Jessica. I'm from Southern California. I'm a current senior, and this summer I got to work at the Cleveland Clinic. So that was a great experience, work in a different healthcare setting. I don't know if it was changed that much because of COVID other than wearing obviously more equipment, but I was fortunate enough to be able to still go to Cleveland and have a new learning experience.
Great. Regan?
Hi, everyone. My name is Regan. I'm from San Diego, California originally. I'm also a senior in the nursing program. This past summer, I worked here in Ann Arbor at CS Mott Children's Hospital in their congenital heart center. Fortunately for our patients, our census really didn't change because kids need heart surgery when they need heart surgery. So I was fortunate that my work environment didn't really change too much, but it was definitely an adjustment with, you know, some of the more stressful situations going on in the hospital. So.
Great, thank you, Regan. Griffin?
Hi, I'm Griff Claft. I'm from Livonia, Michigan, and I am also a senior in the nursing program. I actually had the opportunity this past summer to work at the Cardiovascular Center at Michigan Medicine in the cardiovascular ICU, which has been a fantastic experience. I think, though, noticing the change in our surgeries definitely decreased, and then we also started to just see more of the sickest patients coming into the hospital. So that's how kind of things differed from what I was used to working there.
Great. So now we're going to kind of explore a little bit more about their experiences in terms of their employment. So one of the questions I have for you all students is, what did you find most rewarding? So as you kind of think back of your experience, either within your externship or your employment, what did you find most rewarding in that experience, which can be related to the pandemic or may not be? So yeah, Jess, you want to go ahead?
Sorry, yeah, I can start. So working in Cleveland obviously is very different from here. I'm from California, so kind of being far away again was different. But definitely the most rewarding part of it was working alongside some of the best nurses. The acuity of the patients at the Cleveland Clinic is so high, something I had not worked with before. So like Griffin, I got to work in the cardiac ICU. And we did a rotation. So I also was able to see liver transplants and kidney transplants. I got to go into a heart surgery, and just seeing that role and like what different nursing roles are. So like in the surgical setting or outpatient, we kind of got the full experience, which was good.
Great. Jessica, in that experience, did you also have COVID patients that you took care for, or were they in a different area of the hospital?
We did have COVID patients. When I worked on the transplant floor, that was a COVID cold floor. So a lot of the patients are really immunocompromised. So before they were able to come up, we had to test everybody, and then there was no visitors allowed at all. And in the ICU, it was the same thing, no visitors.
Okay. Yeah, and how do you think that impacted? I'm going to open that up to the rest of you too. I do know that in many hospitals across the country, they had that policy in place just to, obviously keep people safe. How did that impact the nursing role? Did you see that as impacting, looking a little bit different? Griff, you were in the ICU. How about you? Did you see that a little bit different?
Yeah, I think that it shifted to the nurses. I mean, nurses in general provide a lot of emotional support to patients and their family members. But now that their family members couldn't be there, I feel like nurses had to offer more of themselves to care for these patients and support them during, this very difficult, unprecedented, very unknown time for them. A lot of these patients, again, even at Michigan Medicine, were not able to see their family, and not being able to see your loved ones is a thing that I've heard from other people time and time again is very difficult and challenging. As human beings, we connect emotionally with each other, and I think that for them not being able to do that, ultimately that need was not met for them. And so nurses really were the ones that, as well as other people of the interdisciplinary team, but nurses really were the ones that were able to be at the bedside and hold their hand and talk them through this and give them the support that they needed because their family members could not be there to support them.
I can only imagine what that looked like on the pediatric side. Regan, what was your experience with that?
Yeah, so I think something that's really special about or not necessarily special, but interesting about pediatrics is how much the parents are involved and how they're almost a patient too of yours. Like you're taking care of the kid and the parent. And I have experience in our congenital heart center here at Mott encompasses our general care unit, our moderate care unit, and our ICU. And I am currently have clinical in our ICU, but so I've really gotten to see the full spectrum of like cardiac care for children. But I think the toughest thing, so at Mott, obviously, they needed to allow parents in because kids can't be alone like that. But we had a one-parent restriction, and that was our most stringent one. And there was no switching off, so it wasn't like mom could be there Monday and through Wednesday, and dad could be there for the rest of the week. It was just strictly one parent. And I think the most challenging thing was that a lot of these kids were really, really sick, and their parents don't want to leave them because they can't imagine leaving their kid while they're that ill. And as important as that is for the parents to stay at the bedside and how valuable it is that they're there for their children, I found myself and some of the nurses I work with having to really pound on self-care for the parents, being like, hey, you haven't showered in like 5 days, like go home, take a shower. Or, it's okay, your kid is sleeping, like go downstairs to the cafeteria and grab a coffee, go get lunch and things like that. And also reassuring them that like we're going to be there for their kid when they can't be there for their kid. So there were a lot of, nights where I spent like just rocking a baby to sleep because their parents like just needed to go home and actually get sleep in a bed. So I think pediatric nurses are always taking care of parents and kids. And I think during COVID, that was just very amplified because the situation just made everything so much more stressful. And a lot of these kids were really chronic patients that have been in and out of the hospital a lot. And it's hard when both parents can't be there because, the other parent usually provides another source of support for the other parent.
Yeah, absolutely. Absolutely. Jessica, anything else from your perspective? I know you mentioned the no visitor policy. How did that impact anything that you really noted in terms of the role of nursing within that for your experience?
I think it was similar to Griff, and providing that emotional support. A lot of the times my transplant or pre-transplant patients were really nervous, and they would get phone calls in the middle of the night that, oh, you're going to get a kidney. And then possibly 2 hours later, get that phone call of, unfortunately, you're not going to get it anymore. So like being that person to cry with, just sit with and talk to, that was something I found really special, sad, but it was an important part, I think, of our role, and just being able to see that was special.
Great, great. So Griff, tell me a little bit, what was most rewarding from your perspective? I don't think we heard from you in terms of that piece.
Yeah, I think honestly the most rewarding part of the experience that I had this past summer and continue to have is that I am able to work with, I mean, I might be a little bit biased, but one of the best teams at Michigan Medicine. And I am so grateful for this experience to work alongside um, some of the best nurses, respiratory therapists, physicians, um, dietitians, pharmacists, etc. We are a true team, and I think the collaboration among everyone is impressive. And I've just really been able to develop these relationships with people along the way as well. And I think that during COVID, you rely on these relationships. I mean, many of us were spending 12, 16 hours at the hospital, and we're with the same, especially being in the ICU with these chronic patients. You're with the same patients and you see them for a while, and you are with your coworkers during that time too. And, emotionally, we've talked about how it's just a lot to kind of process and deal with. And so being able to um, rely on each other and kind of support each other has been truly rewarding and special. It's really kind of deepened these relationships with other team members and other people that I now consider friends that I've been able to meet through the pandemic. I think something very interesting that Michigan Medicine deployed was the teams where they switched up how the model of care was. And so basically they had, ICU nurses overseeing some moderate care nurses and medical surgical nurses that were taking care of these very sick patients. And so it was just a different team structure. And so I saw a whole different group of people than I normally get to see. And so this was an opportunity to hear about other experiences, meet other people, and kind of become, friends and develop this relationship with a broader, again, group of people.
Yeah, great. Regan, how about you? What was most rewarding?
So I would say my summer experience was probably the most rewarding aspect of it, just would have been how much care I got to provide to these patients and to these kids and their families. They did turn the moderate care unit of the floor I worked on into the COVID ICU for children. However, or the COVID unit for children rather. And we did see patients, but thankfully the pediatric numbers were a lot less than what the adult hospital saw. However, I thought it was really special just getting to, you get to provide your nursing care and do your meds and do your assessments and things like that. But in pediatrics, there's also a lot of room to have fun and like hold kids and play with them and get to know their parents. And I feel like the relationships that I got to build with some families over the summer were really special. One of my favorite stories was we had a patient from Alaska that flew out for heart surgery. And I think the state flower of Alaska is the forget-me-not, but a little kid gave me a pin for my badge of forget-me-not flowers and said, "My mom said to tell you that this is so you don't forget us," or things like that. So I think there's just a lot of really cute and special experiences that you get in the pediatric world that really do make an impact on you. And you realize when you're giving care as a nurse, a lot of times it's the little stuff. I mean, you know, you do, as a nurse, you can do so many things and there's so many skills that we have, but that's not the stuff people remember. It's remembering a parent walking back from lunch and seeing you walking their kid around the unit or things like that. So I think that was the most rewarding experience, or part of my experience for me.
Okay, great. So now I want to switch gears a little bit, and you know, obviously with all of these good things, it's so good to hear about the relationships that were built and those opportunities really for nursing to step in where they, you know, they filled the gaps in a lot of ways, you know, when we didn't have visitors, when families couldn't be there. What were some of the biggest challenges? What were some of the challenges that either you faced or you saw the nursing staff on your units face in light of the pandemic and some of that unknown? Griff, do you want to maybe begin?
Yeah. I think some of the challenges, you know, I talked about uh, with the staff wise, us being in such a stressful time, it made it more challenging. I know a lot of people who work in healthcare were unsure about, can I go home? Can I, you know, be in the same house as my little kids? Or, you know, some of them are taking care of their own parents. And so, you know, finding now different living arrangements and um, other accommodations for it is challenging. And I think seeing that, and also from the patient side, not being able to, you know, connect with their family members, being in a, you know, it's already difficult enough to be in the hospital. It's a strange enough environment when you're not used to it. And being in the hospital during a pandemic is scary. You don't know, especially Jessica and I think both Regan touched on transplants. And so having transplants in the hospital, they're immunocompromised. And that added fear that they could get this, you know, a virus that we know very little about is intense. It's scary. And so seeing that in your patient is difficult. I think that you carry a lot of that on yourself because you as you know, the caregiver want to be able to take it away, you know, not see anyone kind of in this suffering almost. And unfortunately the reality is, you know, we can do as much as we can. We can do our best and support them as much as we can, but I think it's still challenging nonetheless.
Sure. Jess?
Yeah, so obviously with COVID, there's been a lot of financial issues. And one of the things we saw in Cleveland was a lot of healthcare workers getting laid off. And so like coming from working with 2 to 3 patients, my nurse and I ended up with 5 to 6 patients. And that was a big shift. And so learning how to plan and really delegate and prioritize what you're going to do, that was crucial to delivering quality care. Another part of this, I think, that was unfortunate was just not being able to sit down and actually talk to your patients and get to know them. It felt more like we were jumping around and just trying to deliver meds and make sure you got vitals. So it didn't feel as intimate, but it definitely was a good learning experience in terms of how to prioritize your care. It just wasn't the way I like to care for my patients.
Sure. Yeah. Regan, how about for you?
I would say there were definitely, I would echo the things that both Griff and Jessica mentioned. I think one of the things that nurses felt like they were struggling with so much was just the constant like change in policy and in rules and what you're supposed to do, what you're not supposed to do. It sometimes kind of felt like the nurses were the last to know things. I would share. You know, there were a lot of days where we would be doing something and then all of a sudden in the middle of the day, like our manager would come out and be like, oh, no, we're not doing that anymore. Oh, no, you can do that now. And so I think it was just like you were working in a constantly changing environment. And like in the ICU, I think you're kind of used to that. But at the same time, this is like a different kind of changing environment.
Sure.
Like you're used to your patient's condition changing, not necessarily the conditions which you're working in changing. So I think that was something that a lot of people were frustrated with. And I also think it was frustrating, just the visitor restrictions. And, you know, in some ways it was kind of like one parent was kind of nice because it's less people in the room, like a little bit less chaos and things like that. But at the same time, like having two parents at the bedside is really valuable for getting information about your patient, because like the parents are their children's voice. I mean, obviously for like infants and toddlers, but the parents know like obviously so much about their kids. So I think that posed a big challenge as well in terms of just trying to get the information that you needed and also be like helpful and reassuring.
Great. So tell me how has sort of college life during this ongoing pandemic changed for you? So if you can talk maybe a little bit more about your current clinicals. Are any of you in community right now, or are you all in complex care? No community? Okay, so I did see there was a chat, there was a question, and I can address the community side a little bit from our students, but I didn't know if we had any specific. But talk a little bit about how your college life has changed. Regan, you want to start us?
Sure. So campus is very different than what I'm used to. Being like from so far away, I always get asked like, why'd you pick Michigan? Like that's all the way across the country. There's plenty of good schools in California, but I wanted a really big school and I wanted to go to a direct entry nursing program because I knew that's what I wanted to do. And, you know, I'm so glad that I got my first 3 years at Michigan, like done. I'm so glad that I got the full freshman experience. And I'm glad that, you know, I was able to go to the big house and go to a football game and things like that. But, I think this is definitely like, you know, not to put it lightly, but this is a disappointing year. As a senior, you have a lot of like hopes, and I mean, I have a bucket list of like all these things that I haven't gotten to do yet that I want to do before I graduate. And so to not be able to do a lot of those things and to not be able to like be in the classroom with my peers that I've like been in the same room with since freshman year is like is so strange. There's people that I was super close with in the nursing program that I feel like I haven't seen since last year, because in reality, I don't think I have, just because of the conditions we're in. And I think there's still like stuff to do on campus and you still have your friends and your roommates and things like that. But at the same time, like being a nursing student in this climate is really very stressful at times, because I'm constantly worried that like no matter how hard I try to like protect myself and no matter like how well I like not obey the rules but like follow the guidelines that are set in place, like you're just, if you leave your house there's a risk of acquiring COVID, and I don't want to get sick because I want to continue to go to my clinical experience. And so there's a lot of mixed emotions for being a senior in this kind of environment, just because it's not the same Michigan experience that we've had the last 3 years of our college career. But I try to be glass half full as best I can and kind of reassure myself and tell myself that all these things we're doing now, like, you know, if we're able to get like some sort of small semblance of a graduation ceremony in the spring, like then it'll be worth it. But you know, it's definitely different and it's not what you hope for, but these are the things we have to do. And as healthcare providers, it's important that we set an example for the people around us, and, you know, follow the guidelines and be something that other people can look to.
Great, thank you, Regan. Griff?
Yeah, I think going on what Reagan said, it definitely is not the senior year we anticipated or hoped for. However, I think that, you know, I was fortunate to for one of my electives to have an in-person class, and so it kind of gave me some normality, which was nice. And I think that, you know, at U of M, we've been doing a great job on campus to slow and stop the spread, which has been a good thing. I know it's challenging, especially as the weather gets colder, but I think that we've definitely come together to do that, to work towards this common goal. I think that there are not a lot of people on campus as much as we're used to, which is different. I think the whole vibe of campus is a little bit changed. I think even going through downtown Ann Arbor, you can see that some of the same places we're used to going to are no longer there because of the economic effect of COVID-19. And so I think that even changes the vibe of being in college and being in this exciting downtown area and not seeing, your favorite coffee shop or favorite restaurant to go to with friends. Um, and even being able to do that. Because again, like Reagan said, there's a risk of doing those things, and it is challenging, and you want to be able to go out and be with friends and, you know, have some time away from, school and everything else, but it's really challenging given the current circumstances.
Sure. Yeah. Jess, do you want to add anything in addition?
Sure. I think the biggest thing for me was just transitioning from in-person learning to online. The School of Nursing has obviously done an amazing job. They have provided us with a bunch of resources, and I so appreciate that. But I am like an in-person learner. I do like human interaction, talking with my friends, asking questions. And so I think that's been really hard. And then in terms of social, I live with 10 other girls. So kind of knowing what my boundaries are, what's important to me, my patient safety. Currently I'm on a peds oncology floor, and those are the most immunocompromised patients. And so just recognizing that the risk of bringing anything into the hospital to them is so great that I know where I stand and what I feel comfortable doing. That being said, being stuck inside with 10 other girls, you get to know people on a different level. It's more of close relationships and things that I don't think would have happened if we weren't all isolated. So yes, there's definitely been difficult parts, but like Reagan said, just keeping your cup half full, that's really important.
Yeah, absolutely. For all of us, right?
I just want
So
graduation. That's
yes,
it.
I know. We all want that. So just for the audience, just to give you a little bit of a background in terms of how the School of Nursing is made some modifications. I think as the students mentioned, many of our didactic courses are hybrid or fully online. Part of the reasoning for that was related to just simply size. Following the social distancing requirements certainly limits the number of folks that we can have in a particular class at a certain time. So most of the courses that the didactic are hybrid. Some do have that option of coming into class, but it does require sort of prior registration. So there's a lot more complexities involved. The other thing just for you all, we do have some really, we're following the public health informed guidelines. So masking anywhere on the university campus is a requirement, both indoors and out. There's screening that happens when our students and faculty and staff enter the building to assure that they don't have any symptoms of COVID or haven't been in any close contact with anybody who is COVID positive. And then again, the social distancing piece. The nice thing is we cannot say enough positive about our clinical partners. They have been so supportive of having our students engaged in that work. They recognize that importance. So not just, Michigan Medicine is a huge supporter, but also a lot of our community sites as well, and those sort of outside of that university realm. So I can't say enough about that, just from an administrative perspective, as well as having those relationships that say, yes, we know we want the students to be there to learn. In terms of, there was a question kind of related to community experience. Many of our community sites have in the past been public or not necessarily all public, some public-private health, so school districts, county health departments. We've had, a variety of other different community settings that our students have been engaged at. The things that have been modified, first and foremost, is there are quite a few opportunities now where our community experience is virtual. Simply because some of the schools in the area, the districts that we work with, are virtual. They don't have in-person learning. And so we've been able to adjust and modify for our students within that community rotation to still work with those school districts, but they are doing it with virtual projects and presentations and other ways in which they're connecting. The other thing is we have a group of about 20 of our senior students that are doing contact tracing within the university, as well as in collaboration with the county health department. So it's just part of the bigger process of trying to prevent that spread. And it's a way that our students truly just got engaged, and being sort of part of the experience of within the community coming together with the interprofessional team. So part of that group of doing a lot of that work includes public health students, you name it, all the different health schools have been engaged in that work. So that's sort of how we've handled some of the community. I don't know if any of you three have had any specific community experiences to date. They're all in a rotation that I believe it will be next term that they will have their community clinical placement. So I want to kind of move along. I hope that helps just our audience get a little bit more of a feel for, sort of how it is and what we're doing within the campus setting. So I want to just ask, so, with all of this, how have your perceptions of nursing changed, if they have, in light of some of these experiences and this ongoing pandemic? Has sort of your initial thought of nursing when you came into nursing school, has some of that changed in terms of what nursing is? Jess, do you mind starting us off, maybe?
Yeah, sure. So coming into nursing school, I thought nursing was giving meds and moving on. And this experience has really showed me that the nurse's job is just so much more than that. You're not just giving meds, you're a friend, you're a companion, you're just there to support. Also someone that like kids look up to. So again, like I work on the kids unit right now, and a lot of them are often very fearful of the pandemic, which is, understandable. And I think just kind of being a voice of reason for them and also being able to talk to them about it. So you're also kind of an educator. So I don't know, I think the role of a nurse has really expanded because of this pandemic. And I've recognized that definitely.
Great. Regan?
So I would definitely agree with all the things that Jessica mentioned. At the beginning of nursing school, I had some high school experience at an adult hospital taking care of patients. And I think I kind of had some like semblance that nurses did a lot more than just like your skills and things like that. But I know after the pandemic, I feel like people appreciate what we do so much more. I think after the pandemic, especially, like I've never felt like just a nurse. I think that that saying has been like thrown around before, but I know that there's so much more to our job, and there's so much that people like don't realize that we do, and all the stuff we do is important. Like some days I feel like I watch the nurses I work with act as like nurse, social worker, respiratory therapist, like emotional support, like just there's so much to your job. I think also one of the biggest perceptions, at least of nursing, that I've had changed is that like the experience that you get as a bedside nurse is so invaluable to your further learning that you have to do it. And I think coming in to nursing school, I really had the idea in my head that like I wanted to go straight in and like do a master's or a doctorate and like become an NP and those kinds of things. And I think after the pandemic, especially now with my clinical immersion in the pediatric cardiac ICU, I've realized that there are so many different roles that nurses have. And I think I still have the desire to like go back to school and get some sort of higher education. But I also realize like there's so much more to do as a nurse that isn't like being a nurse practitioner. Like I have so many more interests and appreciation for all the different roles that nurses fill, whether it be like care management or like clinical care coordinator, charge nurse, doing all those different things. Like nurses do a lot of stuff other than just like not just being at the bedside, but being at the bedside. And the experience you get there is really gonna, I know, help me to kind of figure out what I want to do eventually later down the road.
Yeah, great. Griff, how about you?
Yeah, I think that being able to see, coming from a family of nurses, being able to see, like, when I was growing up as a kid, I knew they were a nurse. And I was like, wow, that's, as a little kid, I was like, wow, that's so cool. But, not really knowing exactly the role of a nurse until being able to go to nursing school and start my clinical experience and learn from literally the best nurses that are out there at Michigan Medicine, which is one of our big clinical partners. has been truly amazing. I've been able to learn so much about, the role of nursing, specifically being a patient advocate. I think that is the most amazing thing that nurses can do and do all the time. I've seen so many nurses that are like, no, this is unsafe, or I don't feel comfortable doing this, or the patient is going through a lot right now. Let's give them a break, let them rest, and then go in there. Like just being that advocate is truly amazing and special. And I really value that about nursing. And the role of being, someone who is kind of that family member, especially during COVID, and saying, this is not okay, or also communicating. I think one of the things nurses do a really good job is communicating and coordinating a lot of the fast movement that happens in a healthcare environment, especially at the hospital. Nurses are fantastic at just kind of making sure that things run smoothly. And I think that has really affirmed and reaffirmed my interest in healthcare and in nursing. And it has been something truly special to be a part of.
Yeah, great. Yeah. It is the beauty of nursing, isn't it? There's just so many different avenues that one can go, depending on where their passion is. So it's certainly something I know I have truly appreciated about our profession. So I guess that leads to another question is, what are your plans after graduation? What are you guys thinking? What are you hoping? And, do you feel like the experience within the pandemic has prepared you for those plans? So Regan, how about you start us off?
A hard question. um, well, I definitely feel like my clinical experiences and just being in the hospital right now, I kind of have an idea what to expect, hopefully, when I enter the workforce relatively soon within the next year. I think I feel prepared for the challenges that lie ahead in terms of just changing rules and taking care of patients, the boundaries that are set, and those kinds of things. And I can't say enough about all my clinical experiences at U of M hospitals and at our I've had a couple of experiences at the VA here in Ann Arbor, and I think I've always had nurses that were really open to teaching and wanted you to learn. And especially like my clinical experience right now has just been absolutely like life changing. I don't know. I know once I get to becoming a nurse on my own, like I'm going to be scared and I'm not going to feel ready. But right now I feel like I'm ready to be ready to do that. In terms of after graduation, in an ideal world, I would love to go back home to San Diego and hopefully work in a pediatric congenital heart center there. I have really, almost all my rotations in nursing school, randomly enough, have been on cardiology or telemetry floors. So I feel like I've really been exposed to that and I feel really comfortable in that setting. And I'm also really interested in it. So hopefully I'll be able to work in our peds cardiac ICU in San Diego once I'm done, but that's where all my family is. So hopefully, but I'm open to going anywhere. And I just hope that I'm going to be able to find a job relatively quickly.
Sure, sure. And did I hear you say thought is maybe grad school at some point, but you want to get some experience to really see what direction? Yeah, great.
Definitely. I think those bedside years are going to give me a really good idea of what I actually want to do once I get to that point. So hopefully within, the next 5-10 years, but we'll see wherever the wind blows me, I guess. But that would be definitely a big goal of mine.
Well, I know of a great grad school. Come back.
Me too. Me too.
All right. Jess, how about you?
Yeah, so similar to Regan, I definitely want to go back to the West Coast, be with my family. And I really do. I love bedside nursing and interacting directly with the patients. But I think COVID has shown me another side of nursing and like working with Dr. Tschannen and other faculty. That's like sparked a new interest for me and more of like the leadership role of nursing and kind of what they play. And so, yes, I definitely am open to working at the bedside too, because I think that's so vital and just an important part of understanding the healthcare system. But eventually I would like to transition into more of a leadership role, maybe being a dean like you one day.
We'd love to have you.
One day. So, but either way, like I feel like the School of Nursing has really done a phenomenal job to prepare me for that. And I can't thank it enough. So.
Great. Thanks, Jess. All right, Griff.
Yeah, I think something that both Reagan and Jess mentioned is feeling ready. I think when you're going through the program, it's difficult because you feel like, when am I ever going to feel, like a nurse, or like, when am I going to, feel comfortable with things? And I think that it takes time, but I really am grateful for the experiences, especially in this complex care clinical rotation, a mouthful. But I think that they, being in the surgical ICU for this rotation, I've had the best experience, feeling just ready to go out there and provide care for patients, and being safe, competent nurse, which is so important. And I think that this program has done a great job of doing that, especially, making sure that there are resources out there for us to make that transition. I think is very important with, resume building workshops and job interview skills, and just even making that transition and dealing with that emotional impact. So I think, U of M has provided us these resources to do that. I think after graduation, my goal is to continue working in the cardiovascular ICU at Michigan Medicine. I have truly enjoyed being a part of the team there, and I would love to continue working with the amazing people that I've been able to develop these relationships with. I also, like Reagan, have had several cardiac and telemetry rotations. However, I'm not mad about that. I love it. I love cardiac. Cardiac has been something that has been my love ever since we had Dr. Bruggeman in anatomy and physiology. I feel like she is a UMSN legend. She literally was really passionate about making sure we understood the cardiovascular system. I mean, as all systems, but especially the cardiovascular system, because it's very important. And so from that, I've really developed a love and a passion for that. And so I think that would be my goal after graduation.
Great. Grad school in your future too, Griff?
Potentially, yes. I think definitely getting some experience, and then making that transition, definitely considering a PhD option.
Great. And I know Jess is going that direction with her leadership too. So excellent.
Better watch out. I'm coming.
All right. Oh, are there anything else, any other comments or things you'd like to share kind of in terms of your experiences with the audience?
I would just love to say that being at Michigan was 100% the best choice for me. I feel like there's nowhere else in the world that I would have gotten this amazing of a nursing experience. And I think what's so unique about Michigan is that everyone that works here and teaches here is really smart, but is also really passionate about what they are smart about, and they want to share that knowledge. And the nurses want to show you how to do things, and they want you to be the best that you can be. And I feel like that's such a unique experience that I've received here, because I have friends at nursing schools that are amazing in other parts of the country, but having people teach you, like Griffin said, I have vivid memories of Dr. Bruggeman giving us this cardiac cycle worksheet. I can see it in my head right now. Learning from people who are really passionate about what they're teaching about, and passionate about teaching students, and excited to be a teacher and be a teacher at Michigan has really made all the difference. And it's just gotten me excited to be a student here and be a nurse. I feel like compared to anyone else I know on campus, nursing students are the most passionate about being nurses. So I've just loved every second here. And although like this is not the senior year I expected, I'm still getting everything that I need to reach my full potential. And I feel like I kind of want to add, because like Jess and Griff seem like they have a lot of things in their future for them. But I think a couple of my clinical instructors have really inspired me to maybe like eventually want to be a clinical instructor myself. So like just the people that teach at this university are the best people and the most perfect people to be teaching at Michigan. So I've loved every second here, and I'm so grateful for all the people that I've learned from here, because they have made me the nurse that I know I'm going to be soon.
Great, thanks for that, Regan. And I will say, you know, when I think of academics and the role of faculty, and, you know, we sort of create the structure, but it takes students to really do the work. And so I think, you know, we've got 3 panelists here that are speaking to that. You know, we've set the stage, but they took that extra to make it happen and be successful. So you should be giving yourself a round of applause. And I know you're almost there. You're almost there. So anything else, Jess or Griff? And then I think what we'll do is we'll go ahead and open it up if there's any questions. So for those that maybe have some questions you'd like to ask the students, by all means, please type it in the chat, and we can see if maybe we can address those in our last few minutes of the webinar. But anything else, Jess, Griff, that you'd like to share?
I think just one thing I wanted to touch on was working in Cleveland, there was a bunch of other students from a bunch of different nursing schools, and we would sit in classes and learn cardiac, GI, all these different topics. And what I remember thinking, sitting in there, was we learned this sophomore year. We learned this already, and a lot of the other nursing students had not even touched on the subject. So the level of preparedness that I felt going into it, it was astronomical.
Great, great. Anything else on your end, Griff?
Yeah, I think just to also add on to what Jess said is that U of M has given us a very, what I would say as well-rounded experience. I think that we've gotten knowledge and skills from all different areas, and been able to work with people from many different perspectives. Especially, I know through the School of Nursing, there are many research opportunities, and so being able to be a part of that has been truly remarkable. Shout out to Dr. Dina Costa. I've been able to work with her. She's been amazing. And I think that her research, and I know other honor students and other people in the program participating in research, has been profound. I think that it's been a positive thing. Even through the pandemic, we've been able to continue that research. And so I think that support has been great from UMSN as well. Good,
great, great. So one of the questions that I did see on the chat was related to political advocacy, sorry. So the question was, do you get any exposure to political advocacy for nursing and healthcare? And Lauren Underwood, who actually received her bachelor's from the University of Michigan, she says it's a great example. Certainly, she absolutely is a great example of following one's passion, as she is the current, she's in the Congresswoman. So do you guys want to speak at all in terms of your exposure to policy, to advocacy within your courses?
I know like that's aspect that I hope might be more heavily emphasized within the School of Nursing curriculum. I feel like freshman year would be, I thought the intro course we took, it's a little bit different now to my understanding for the freshmen that are currently enrolled, but we took one with Dr. Patricia Coleman Burns, I believe. And I felt like there we learned a lot about social determinants of health and different kind of healthcare policies that you should be aware of, and that you should understand how some of these policies really create a barrier to care for patients. So I felt like that was where I got my greatest exposure. Something else that the School of Nursing is involved in that I've kind of dipped my toe into is that us, along with the medical school, have the University of Michigan
Yeah.
student-run free clinic. It's mouth
Yeah.
load, where we see patients that are uninsured and we get to treat them out in Pinckney, Michigan. So I felt like that's kind of a good way that has kind of piqued my interest in like at least healthcare policy and healthcare advocacy. So I feel like that's where I've seen my greatest exposure. And I definitely know there's a lot of opportunities for students to like further their interest if that is something that's really passionate. There are a lot of elective courses that are available to us that you can take that kind of dip into that realm.
Mm-hmm. And I'm just going to add to that. One of the things, so again, that the audience may not know is we're in the midst of a curriculum redesign. And at this point, we are now in the throes of finishing up our redesign for the senior year. And one of the modifications within the curriculum has been we've typically had a community lecture, clinical sort of experience, and we now have expanded that to population health, having more of a focus on population health. We're looking at these concepts of advocacy, not just at the patient level, but also at the policy level. So there's a lot of additional things that are going to be in play as we kind of roll out this new curriculum. I'm going to keep going because we do have a few questions on here as well. And so I'm going to open this up to any of the three that want to answer this. But the question is, if you could change one thing about healthcare in the US, what would it be?
Yeah, I think I can speak on this.
Great.
I think that one of the things people often mention, especially nurses, is that nurses feel that more work is being put on them, and that there is more for nurses to do, which can be a good thing, but it also can be very taxing. And I think there's often a conversation about burnout in nursing, and being overloaded with work can be a sense of burnout. And so I think addressing this, the mental health and emotional concerns of nurses and other healthcare professionals, I think would be very important, especially after this COVID-19 pandemic. The emotional toll of it, I think we need to change that and work on taking care of people who work in healthcare and taking care of ourselves and having the resources to do that. I also think that obviously we need to continue our work in improving our or addressing our health disparities, especially, there are many vulnerable populations. I think we see with right now in our world, especially with the African American community, and with even like transgender community, we are experiencing a health crisis in those communities. And so I think we need to be able to address those health disparities and really find ways that reduce poor outcomes for these populations. I think, also another thing that, needs to kind of change or improve is access to healthcare and cost of healthcare. We talk about insulin prices in the United States and how through the roof they are. And so I think addressing this and making healthcare more accessible is important as we continue moving forward.
Well said, Griff. Thank you for that. I'm going to continue on. Next question. So this is from a former graduate of the master's program. And certainly she says, I'm so proud of the conscious insight displayed by the students participating in this conversation. And I would agree, you guys are fabulous. My question is, what are they doing to deal with the stresses they experience now and in the future? So I think it speaks to a little bit of what you just said. Griff?
Yeah, I can touch
Yeah.
a little bit. Oh, sorry, Griff.
No,
No,
go ahead, Jess.
go ahead.
I was just going to say, for me personally, working out has been my number one thing. I enjoy running. I enjoy doing Pilates. So like personal time. Also just kind of leaning on each other. Our whole nursing class has a group me. And if any one of us has a question, we'll send it in and immediately you get a response. And so in terms of like class stress, that's really reduced because there's always someone there to answer a question for you. I know the School of Nursing also has implemented a CAPS counselor. So she's always available to talk to. If you're struggling or having a hard time, she's always there. And then again, the administration has been really great with just letting you know, hey, everyone is having a hard time. Come talk to us. We're here for you. So you never feel like you're alone in any situation.
Thanks, Jess. Anything else, Regan or Griff?
Yeah, I was just going to add one thing. I feel that a lot of seniors specifically are experiencing right now is how exciting our clinical rotations are right now. Like, I really have not heard from any senior that they don't like where they're doing clinical. It's just a really fun experience because you're in this one-on-one environment with a preceptor that knows you and is getting to know you and working with critical patients. But at the same time, a lot of us have jobs on the outside. I have another hospital job outside of my clinical, and so do a lot of other students. And Griff touched about like burnout in healthcare workers. For me, it's realizing that like as exciting and as much as I love going to clinical and as much as I love going to work, because I also love my job, that it's important that I set boundaries as to like picking up shifts, coming in for overtime, you know, staying over when I only signed up for 8 hours versus 12. Setting those boundaries has become very apparently necessary for me, because I kind of feel like at the beginning of the year I found myself working a lot and going to clinical a lot, and it was becoming a little bit too much, and I realized, you know, the world and the hospital is going to go on without me. So making sure that I'm setting boundaries for myself in terms of like work and scheduling my time appropriately so that I have time to actually like cook myself dinner versus putting something in the microwave. So that would be the biggest thing that I've realized, and I know I'll be able to carry on once I'm actually a nurse.
Anything else, Griff, from your side of things?
Yeah, I think that just again, making sure that you prioritize yourself. Reagan touched on it. You are the most important, and the work at at the hospital will continue. But I think it's important again to make sure you're going out there, and whether it's exercising, connecting with friends, just really addressing those emotional and social needs that you have.
Yeah, yeah. Self-care is so important, and recognizing, right, that we have to first take care of ourselves in order to be able to take care of others, right? So, well, I want to, on behalf of, our participants here, I want to thank our panelists. As you see, we have phenomenal students here in the School of Nursing undergrad department, and it is truly a pleasure. I'm so grateful to be part of that undergrad program, to be able to connect with these students. So thank you all to you. Corrine, is there anything else that we need to follow up with? But thanks to those two that have joined us.
No follow-up. Thank you.
All right. Well, thanks, everyone. Have a great day. Stay safe. And I hope that this was helpful for you. All right. Take care, everyone.